So one of my stories that have stuck with me all this time was I was in Kent working as a client service representative, and I called this young girl that was there for assistance. She sat across from me. She had just arrived from Central America. I asked her, I said, so, what are your living conditions? She told me that she was living with a friend of her family from back home. She also mentioned that she had to get on dialysis, that was the reason why she came up here, because, there was a possibility that she could get the help here, and back home they didn't have the resources. So I explained to her a program, the Apple Health program. And I said, will you be interested in applying for this? And of course, she said yes. But she came back several months later, and, she had a smile on her face. She brought me a Snickers, and she said, I remember this word so clearly, and she said it in Spanish. How is it that I could ever repay for what you did for me? And I don't know, that made a big impact on me, because, although it took us all this time to help her with the application, the outcome was beautiful. I could repeat the story over and over, and I always get emotional because, I could picture this young girl being 22 years old and being here alone in a world that she does not know, a language that she does not speak. So, that kind of touches home. Hello, my name is Rosie Martinez. I am a client service representative for the contact center.
The CSR team is an indispensable group of compassionate, self-motivated professionals who are passionate about assisting clients, HealthPoint patients and non-HealthPoint patients, by finding available insurance programs and other services in order to receive the care they want and so desperately need, and to further serve HealthPoint's mission to remove barriers to care.
The community that we serve, a lot of them don't know what kind of helps are out there. They don't know that they can potentially qualify for Apple Health, or even cash assistance or food assistance. And I take it very seriously because, at one point I was there. I was uninsured, no income, and, someone helped me. They reached out to me and helped me, and I feel that, we got to pay it forward. I was born in Mexico. We came up to the United States when I was in first grade. My dad did a lot of farm work and a lot of agriculture work, so we stationed in Yakima, and I lived there all my life. I didn't think there was another world outside Yakima. I started college, and I was a single mom, and I lost my job, and I had to tell myself, what's more important to you right now, my education or my son? And I chose my son. When I moved to King County, it was my son. He was 4.5. He's 17 now. So I've been with HealthPoint. I'll be 13 years in December. I love their mission. I love the fact that if I talk to one person today, or I've talked to 10 people today, and I'm able to make somebody happy or help them with what their needs are, that makes me want to come back to work tomorrow and the day after. And, I have bad days because, we listen to our patients, our clients' stories, and of course it affects me. But I can honestly tell you, I love working for HealthPoint.
I couldn't do it without the CSRs. And I know that our patients depend on them and trust them because they are part of our team and because they are these caring, sensitive, supportive individuals who are mission-driven and so full of respect for the sensitive information that they become privy to. Really depend on this team to help us with those things that are beyond the medical care that I can give. And I trust that they're going to be able to find housing, food, transportation resources for our patients, and help them find and keep insurance so they can continue to get the best possible care. Thank you, CSRs. Thank you for letting us all give our HealthPoint patients the best care possible.